Hello everybody, welcome to my YouTube channel, Homoeopathy Super Sessions by Dr. Jargos. Today I'll be taking J.H. Allen Volume 2, the Sycosis part, as requested by one of my viewers. For every earnest and thoughtful physician must have seen, before being long in practice, that there is something about the disease he encounters that makes them difficult to eradicate. So, Dr. J.N. Allen, in his Volume 2 of the Sycosis part, says that every physician in his practice will encounter cases which are difficult to cure or difficult to eradicate. Something that makes disease stubborn, persistent and positive in its nature and difficult to cure. So why does it become difficult to eradicate the disease? Because there is something in the disease which is persistent and which is positive in nature, and it is difficult to cure. So that means there is something in the disease which has to be removed. Because of its stubborn and persistent nature, the disease is kept up and the disease is progressing. So this portion has to be removed in the disease. Thus, it makes it difficult to eradicate the disease. Now, what is it? It is a dreadful miasmatic imprint which leads behind in the disease, making it still more difficult to cure. So what is present in the disease which is stubborn and persistent? It is nothing but the miasmatic imprint. So the miasms are present in every disease which makes it difficult to cure. So basically, we have to treat the miasms. Let us now deal with the sycotic miasm. So Dr. J.H. Allen says, now let us focus on the sycotic miasm. We must treat it not only from the etiological, pathological, and pathogenic point of view. So he says that we mustn't treat this sycotic miasm from the etiology or according to the pathological point of view, but we must study it carefully from its therapeutic side. So if you want to become a successful physician, if you want to remove the stubborn and persistent obstacle to cure, that is the miasm, you have to carefully treat it from its therapeutic side. We must look closely into the dangers of unscientific methods of treatment of this dreadful disease and the grave danger that lies in suppressing it in any stage of its action. Furthermore, he says that we have to look into what unscientific methods are used to treat the diseases. Because if unscientific methods are used to treat the diseases, then it will suppress the disease. As a result of it, the disease will become more difficult to cure. Dr. Charles J. Hempel, who says that disease is the totality of the effects by which we recognize or perceive the action of a peculiar order of subversive forces upon an organism which has been specially adapted or prepared for their reception. So Dr. Charles J. Hempel says that the disease is nothing but the totality. And we have to recognize this totality, or we have to perceive this totality. And we have to see what are those inimical forces which are acting upon the organism, and as a result of which the organism gets susceptible and the disease sets in. Out of these subversive forces comes either directly or indirectly, all which is known as the disease. So these inimical or the subversive forces, they may be either directly or indirectly affecting the organism, and as a result of which the disease is born. Hahnemann has recognized these special forms which he designated as psora, syphilis, and sycosis. So these subversive forces are nothing but the miasm, which he has given the names of psora, syphilis, and sycosis. These subversive forces are also called the chronic miasms. They are the representation of the internal disease, each having its own peculiar type of character. So the miasm will represent the internal disease, and each miasm has its own peculiarity type of character. That means what? Each miasm has its own ailments from, it will have its own predisposition, disposition, diathesis, and different expressions. So if you know these 5 points of each miasm, you will be able to distinguish the psoric miasm from the sycotic miasm and from the syphilitic miasm. So as you all know, the internal cause of the disease is nothing but the miasm. life force is not being able to get free from it without any assistance. So when the miasms are activated from the slumbering or the latent stage, the life force is not being able to get free without any assistance. That means what some assistance is required in order to free the life force from this dangerous miasms. All the miasms have the primary, secondary, and tertiary stages. So all miasms have the three stages, that is the primary stage, the secondary stage, and the tertiary stage. The life force gets disturbed due to the action of the chronic miasm. So actually, when the chronic miasms get activated, the life force gets disturbed. So the harmonious functioning of the life force is disturbed, or the equilibrium is lost, and there is disequilibrium, as a result of which the disease sets in. It produces inflammation, stasis in internal organs, spasms, and convulsions. So what does the miasms do? They produce inflammation. That is, for example, sycotic miasm. It produces stasis in internal organs. For example, the sycotic miasm, the spasms and convulsions. Thus, the anatomical and physiological deflection arises directly or indirectly from the three chronic miasms of psora, syphilis, and sycosis. So, whatever anatomical or physiological processes are there in the body, they get disturbed or they get deflected. And from the normal anatomy, you get the abnormal anatomy. From the normal physiology, you get the abnormal physiology. So you are seeing a shift from the anatomical and the physiological point of view, or you're seeing the deflection. This deflection is because of the three chronic miasms which play havoc in the body, that is psora, syphilis, and sycosis. Now, it can occur singly or in various degrees of combination. So these three miasms, psora, syphilis, and sycosis, they can either occur singly or in different combinations, like syphilis, psychosyphilis, and or all of them. So there are different permutations and combinations which the miasms can present the cell. The miasms will present themselves with. So a single miasm is easy to treat. A combined miasm will become more difficult to treat. The oldest inimical force is the psora miasm, which becomes the basic miasm or the first cause of all the disease in the human organism. So J.H. Allen tells us that, just like Dr. Henneman, he tells us that the oldest inimical force is the psoric miasm. So all diseases start with psora, and then from there they bifurcate into the sycotic miasm, into the syphilitic miasm, or into the pseudopsora miasm, that is the tubercular miasm. It can present itself in different ways, from functional changes to distortion. So the miasms, they can present themselves in different ways, right from functional changes to the totally destructive changes or end organ damage. It depends on which stage the miasm is, either the primary stage, secondary stage, or the tertiary stage. It may also progress slowly, giving rise to ulcers or growths. Or ulcers or growths also may be seen. Now, sycosis cannot be equated with gonorrhea. The well-known specific urethritis represents only in its initial stage similar phenomena to that of sycosis. So basically, any miasm cannot be equated with the disease phenomena. So with respect to sycosis, sycosis cannot be equated with the disease of gonorrhea. So gonorrhea, it is well known for its specific urethritis, which is seen in the initial stages. And this sort of a phenomena is also seen in the sycosis miasm. The history of the two diseases differ widely in their constitution and development and progress. So gonorrhea and the sycotic miasm, both of them, they differ differently with respect to the constitutional development and the progress. Sycosis implanted in a rich pseudosoric soil develops into one of the most formidable enemies of the race. So if sycosis is implanted on the pseudosoric soil, that is a tubercular miasm, it becomes very, very difficult to treat. What the pathologists of today call gonorrheal infection is what we term sycosis. Sycosis presents itself with painful and spasmodic symptoms. So the hallmark of the sycotic miasm, the pains will be spasmodic, colicky type of pain. So therefore, Dr. J.H. Allen says that sycosis presents itself with painful and spasmodic symptoms. There is marked specific urethritis with burning pain at the meatus. The color varies in different cases, but it is generally a dirty colored pus, yellowish green, or a mixture of brown, yellow, and green. So the discharges of the sycotic miasm are generally thick, greenish yellow in color, but he's given a variety out here. He's saying it is a dirty colored pus, yellowish green, or a mixture of brown, yellow, and green. Quite often it is offensive, and in many cases has a stale fish, musty or fish brine odor. So this is a characteristic odor of the sycotic miasm, that is a musty odor or odor of stale fish, or just like a fish brine odor. Its incubation period is from 5 to 10 days. The patient early shows more or less mental anxiety with a desire to frequently examine the organ. So when the sycotic miasm takes over the body, or it is get implanted in the body, then what happens? Besides urethritis, the patient will be very, very anxious, and there will be a desire to frequently examine the organ. When the discharge is suppressed, a secondary stage of disease develops. So as long as you do not suppress the first stage of the disease by the unscientific means, nothing will happen. But if the patient takes unscientific treatment and suppression takes place, then the disease from the primary stage will go into the secondary stage. Now, in the secondary stage, it is characterized by stasis to the internal organs, more manifest in the pelvic inflammation of the women. So the secondary stage occurs where the disease goes into the more deeper organs or the more internal organs, and in the female, it will give rise to the pelvic inflammatory diseases of women. If not treated by concentrated treatment, it will pass into the secondary stage. So if concentrated homeopathic treatment is not given, then it will pass into the secondary stage. So it will pass into the secondary stage, number one, if it is suppressed, and secondly, if proper concentrated treatment is not given. Then it will often pass into the tertiary stage within 1 to 3 years. And the tertiary stage will be evident within 1 to 3 years. If not cured, it may last the entire life of the patient. So if it's not cured by then, the patient may suffer for his entire life. The disease may pass into different organs of the body, causing gouty concretion of the joints, gout of the heart, stomach, etc. So in the tertiary stage, you will see that the disease passes into the multiple organs, causing gouty concretions in the heart, stomach, joints, and so on. And mentally, there will be mania, insanity, and many other mental aberrations can be traced to suppression of this miasm. It is a disease of lust, hence the appearance of the mental phenomena in its early history is evident. So J.H. Allen says psychosis is a disease of lust, and as a result of which the mental symptoms will be prominent. The will is overthrown, as a result of which this thinking, action, and behavior develops the lust disease. So whatever will of the patient is there, that is overthrown because of his wrong thinking, his wrong action, and his wrong behavior, as a result of which the lust disease develops. It is because of this lust disease that he gets the sycosis miasm. All his processes, whether moral, spiritual, mental, or physical, are interfered with the miasm. So the miasm will affect the full body, that is the mental level, the physical level, the moral level, as well as the spiritual level. Dr. J.H. Allen says that 80% of the adult males are affected by it. And he says, no wonder that so many of our women are sufferers from pelvic affections, rheumatism, or chronic gout. So the males are affected, they pass on this miasm to their partner, as a result of which the women suffer from pelvic affections, rheumatism, or chronic gout. The majority of married women suffer in some way from psychosis, either from the suppressed or imperfectly cured forms. Children born of such parents invariably show some form or manifest the disease, and not infrequently ophthalmia neonatal. So if a child is born from an infected parent of the sycotic miasm, then the child may be born with ophthalmia neonatal. If they escape this disease, they suffer from colic, which is severe and specific in nature. If, however, ophthalmia neonatal doesn't develop, then the newborn child will have the colic, which is specific and severe in nature. This colic is quite different from the flatulent colic. The pain usually comes in paroxysms, or it is of a spasmodic nature. So the pain comes in paroxysm, or it is spasmodic in nature. sometimes relieved by pressure or by the child lying upon the stomach. So it is better by pressure or when the child lies on the stomach, or being carried about in arms of the nurse. Again, shaking or rocking gently seems to modify the suffering. So if the nurse carries the child in the arms, the child feels better, or if the nurse will rock the child also feels better. Heat gives temporary relief, but all foods greatly aggravate even the mother's milk. So the abdominal pain may be better by application of heat, and mother's milk will aggravate. Although food, when first taken, seems to give relief for the time being. So initially, when the food is taken, it gives some relief, but later on it aggravates. Gas is frequently expelled from the stomach or bowels with great force, and it is quite pathognomic of the sycotic colic. So in the sycotic colic, we get paroxysm of pain, spasmodic in nature, with all these modalities. And important part is that the gas will be expelled with great force. Many a times I have relieved these little sufferers with a few powders of lycopodium or argentum nitricum. So Dr. J.H. Allen says that such newborn people or such newborn neonates have been better by giving the powders of lycopodium or argentum nitricum. Both these remedies seem to be frequently called in these cases. Again, if they should be fortunate enough to escape the colic, other manifest of the disease are met. So if the child escapes ophthalmia neonatal, if they escape the colic, then they may suffer from indigestion, catarrh of the bowels, vomiting of food without apparent nausea, diarrhea, the stools being sour smelling, acidic, and excoriating the infant about the perineum. Quite often, these children escape the gonorrheal ophthalmia and have in its place sniffles. So many a times, instead of gonorrheal ophthalmia, the patient or the child may have snuffles, which makes appearance a few days after the birth. It closely resembles the disease of the ordinary coryza, yet on examination of the nasal passages, we will find a specific form of rhinitis known as snuffles. So in snuffles, what happens? The nose is dry and has a stuffed up feeling. The child will scream with anger, and its attempt to breathe with its mouth closed. This is more noticeable when the child nurses. So when such snuffles occur, instead of ophthalmia neonatorum, the nose is dry, the child is very cranky, he will shout with anger, and he will not be able to breathe with his mouth closed, especially noticeable when the child is when the child is nursing. The history of the parents will relieve psychosis and has been suppressed or imperfectly cured. So if you take the history, you'll find out that you get a history of psychosis which has been suppressed or which has been imperfectly cured. The diarrheas of these children are usually of a greenish, sour, slimy mucus nature. So if diarrhea sets inside, then it will be it will be greenish, it will be sour smelling, slimy, or mucus in nature. The stools of chamomilla, rheum, and maca are often very characteristic of psychosis. Often the child itself will smell sour, and no amount of bathing seems to sweeten it. So the whole child will smell sour, the diarrhea will smell sour, the whole child will smell sour, and no amount of bathing will sweeten it. The higher and highest potencies will be useful in treating such conditions. So the indicated remedy, whatever remedy you're giving according to symptom similarity, the highest potencies will be useful. Dr. J.H. Allen says you will get 10 times more prompt action in these deep chronic diseases from the CM potency than you will get from the lower one. So he's found in his practice that in such cases, if you give the CM potency one powder, then miraculous results will take place. Many cases have been described of suppressed psychosis. So in this chapter, also if you read many cases, he has described of the suppressed psychosis. So that's all for this part. Stay tuned for more. Part 2 will be coming up soon.